All right. Well, hello, everyone. I hope everyone is having a wonderful, blessed afternoon. We're so grateful to have each and every one of you here for our work session on this afternoon. And we have our wonderful guest with us, Dr. Cephas Archie, as well as Dr. Rose Nichols. It's so great to have you guys presenting to us this evening, and I look forward to hearing your presentation. BJ, I cannot see everyone on my screen, so if you would please, could you announce all of our folks that are our colleagues that are with us this afternoon?
My apologies, Vice President. I was grabbing something from the printer for a quick second. So the folks on the line are Katie Hasselwander.
Would you go ahead?
Katie Hasselwander, if you'd like to introduce yourself and role.
I'm council staff.
BJ Scanlon, council staff. Mary Lupian.
City Council East District.
Jacqueline Ortiz.
Hello, Jackie Ortiz, member at large.
Dr. Cephas Archie. Would you introduce yourself and your title?
Good afternoon. I am the City of Rochester's Chief Equity Officer, and it's a pleasure to be on the call this evening.
Mitch Gruber.
Greetings, everyone. Council member at large.
Willie Lightfoot.
City Council Vice President and Council Member at Large. Thank you.
Thank you. Dr. Rose Nichols.
Good afternoon. I'm the Deputy Director for the Department of Human Resource Management with the City of Rochester.
Jose Pio.
Good afternoon, Jose Pio, Councilman for the Northwest.
Lachey Harris.
Good afternoon, Lachey Harris, City Council South.
Michael Patterson.
Good afternoon, all. Mike Patterson, City Council Northeast District.
Hazel Washington.
Good afternoon, Hazel Washington, the City Clerk.
Conda Brown.
Good afternoon, everyone. Condoleezza Brown, Deputy City Clerk.
Josanne Reeves.
Hi, everyone. Josanne Reeves. I'm the Mayor's Liaison to City Council.
And that's everyone on the line.
All right. Thank you, BJ. Dr. Cephas, I asked you to come and present to council, and we say welcome you first and foremost to City of Rochester in your new position. It's a pleasure and honor to have you on our team and along with the staff as administration. And I just felt that we would like for you to, kind of give us a presentation, let folks know who you are, what you're doing, what work you're planning and preparing for as we move forward. We know that we're in some very trying times, to say the least. So I think you coming in and being baptized by fire is probably a good thing for us now. And I just wanted the council members to get some clarity as to what you perceive this role to be for you and your mission and vision as you move forward. So I'll turn it over to you, sir.
Well, first off, again, I say thank you for the opportunity to be here today to spend some time talking about some of the work that I intend to lead and be a part of. I'm grateful to be a part of the Rochester community. I'm grateful for the personal relationship that I am fastly developing with Councilman Lightfoot, who has been a great conduit for keeping us connected with the efforts, the priorities, the next step action items for the City Council. And so it's a pleasure for me to be here today. If you could, I want to share, is it okay if I can have access to the screen? I think I have
I've already given you permission to do so.
Okay, wonderful, great. Pull up. Thought about what I needed before I knew I needed it, so thank you. What I will say is that this has been it feels like I've been here for 10 years, although it hasn't even officially been 2 months yet. There has been a lot that has occurred and transpired since my time joining the team with the city, and I have intentionally been baptized by fire, and it has been a roller coaster, but it has been a very notable, well time spent, well energy invested opportunity, and I'm grateful for it. So as stated, I welcome there to be questions. I'm going to give a little bit of a briefing about sort of the framework in which I lead, because I think that's important to understand the context of how I process information, and whenever I walk into an environment, to make sure that I am looking at and honoring some of the work that's already been done, but also looking at the opportunity to collaboratively come together with stakeholders to say, what can we develop together to see what this could look like? And so that's important, because what it does is it honors the work of the people who have been doing it for quite a while and gives them the integrity and the support to honor that, but also looks ahead and forward to say, how can we take this work and build upon it so that it's more inclusive and more collaborative and more equitable? These are very unique times. These are very unique times to be in the field of equity, of inclusion, of diversity, specifically post and during the middle of times of COVID-19, as well as in the current national, regional, statewide cultural unrest regarding the targeted treatment of certain community groups based off of race. And so how are we developing a plan to navigate this landmine that can oftentimes be very uncertain, but providing steps of progress nonetheless? I don't believe in saying just because it's not easy, we won't do it. The commitment must be there to say we will go even in places where others have not. And so this is where I want to be very clear about my role in developing strategies to move things forward. And having said that, I want us to talk about starting this dialogue with understanding sort of some framework, if we could. So having said that, so there is a book that I'm certain many of you, if not all of you, have read, and if not, then I'll be more than glad to talk about some of it. And I'll drive as well, because there are certain people trying to enter the room, and since I have the floor, I'll have to let them in as well, because I see that now on the technology. But there is this book, Good to Great, which I'm certain many of you have read, and I appreciate this book so much, as it was a book that I became quite intimate with during my doctorate program, that really planted a great seed of leadership, but specifically how to be effective in leadership. And so there were some specific things that I found that it compared industries and companies that were within industries in comparison to companies that were good within a specific industry in comparison to companies that were great. Many of you have seen all of this, so I won't go into much detail. There was an 11-year study where it compared industries and companies that were within a specific industry. There were, and I may be dating myself a little bit, and I gladly do so, but during my time, I knew of stores called Eckerd and Silo and A&P. Most of the comparative companies and industries that are here, some of them are no longer here, like Circuit City, etc. But what they did in this 11-year study is they compared companies such as Walgreens to Eckerd, Circuit City to Silo, Kroger to A&P, Philip Morris International to R.J. Reynolds. And what they did is they intentionally looked at the scope of progress and profit margins that distinguish these two sets of industry companies and compared them to each other. If you look at the bottom line, I don't know if you can see my cursor here, but this bottom one highlights all of the companies that were great, that were good at that time. And the aforementioned one at the top shows the profit margins of the companies that were great. So the reason why this so stood out to me is because as a city, we've stated that our focus is not just to be an alignment or compared to our sister cities and cities and nations, cities and states across the country that are doing good work, but it is our intentional emphasis to look at how do we become great. And so this study has looked at the companies and the profit margins and the steps made by areas and industries that were great, and it found some common trends. And I want to highlight 3 of those trends that really will provide us with the framework of how I think about things when I come into an opportunity such as this. So there were 3 things. One of the things that was found in becoming great was that greatness is not a function of circumstance. Greatness, it turns out, is largely a matter of conscious choice. So none of the companies that were identified as great became great because of a one quick, isolated, independent decision. They became great because it was through intentional choices that with every component of what they did as a business, they focused on, does this compare with margins that are just good, or does it make us compare it to margins that are great? And so what they found is that in operating in an emphasis of intentionality, not through sometimes, not through it being an add-on or, oh, at the end of the day, oh, what have we done for diversity? Okay, now that the structure is already included, now that the budget is already balanced, now that the policy is already written, now that the hiring practices are already embedded, oh, how do we, let's go back and make sure we brought in people or instances that focus on equity. What they found is that companies that became great became so because it was a core function of who they were. It was a highlighted operational procedure that was embedded into everything that was done. Through every department, through every manager, through every leadership training, inclusion became a part of the network. And so it became through intentionality that these companies became great, through conscious choice. The second was the good to great companies did not focus primarily on what to do, but they actually also looked at what not to do. So specifically, there was a component of looking at the option to assess and modify. So what they found is that when they looked at all of the things that they were doing on an operational basis, all of them, and said, all right, what are we going to do to improve? What they found is that the list of things to stop doing brought more value than the list of things to start doing. And so what that really resonated with me in a deep way is because what it requires is that before we go out and look at finding these great new initiatives, new programs, new trainings, new funding sources, all of these great opportunities, instead of us bringing in things that we have not fixed internally first and going out grabbing in new things to pile on top of the things that already aren't working internally. So what it does is it leads us to the point of, before we go out and bring in the new, how are we inventorying and assessing what we have now? So what are the policies? What are the practices? What are the laws? What are the behaviors? What are the procedures that we have in place now that are currently focused to get the outcomes that we say we want? And if we're not getting those, how are we first taking a look at what are we doing now that's stopping us from becoming what we say we want, before we go out and bring something else new on top of the things that we already see aren't working. And so what this commitment is, and the second component, is to say, how are we looking at an inventory and assessing what we're doing now and seeing what we need to fix first, what we need to modify, what we need to amend, so that we're doing things that are effective, so that anything that we bring in new will fit into the gaps of what we found is or is not here currently. But we do that after first saying, what are we doing now that we need to stop doing, before we start looking at the things to do. The next component of this sort of three-pronged approach was the good to great companies came to be by a sort of a cumulative process. As we stated, there was no single defining action, no one killer innovation, no solitary lucky break. There was a unified conformity of acceptance that we as a company, as a business, as a city, as a region, as a state must change. So as my background, I was a therapist for a good number of years. That the moment that I would appreciate most in every one of my sessions with the client is when we would get to that point where they would become self-aware that there was something that was preventing them from becoming what they said they wanted to become. Because the first component of change is to at least be aware that we must change, or that there is an acknowledgement of something. And so in recognizing this critical point, when it was recognized that collaboratively and inclusively, through repetitive actions that were made with concise decisions that aligned with our values that we must change, was that the third sort of collaborative point. Many of you who read the book, there's sort of a famous component that talks about getting the right people on the bus, right? That was a great analogy. In order for you to want to drive change, you got to get the right people on the bus. They even took that analogy one step further and said, not only do you have to get the right people on the bus, you got to get them in the right seats, so that their talents, their skill sets, their knowledge bases are actually placed appropriately in the place to drive the change where we said we wanted. And so looking at all of these specific parameters, why do most overhyped change programs fail? Well, because they lack accountability. So is it your job or is it my job to look at equity or diversity and inclusion? Or is it all of our job? They fail to achieve credibility. So the sort of, how are we assessing what we're doing now and seeing if that's working, or are we simply doing what we've always done and not actually taking the look to assess and improve upon what we're doing currently before we bring in something new. And so the third component of that was the ability to have no authenticity. And so that's intentionality. So they don't think that the true desire to change or the intentionality of how we approach change or we approach collective opportunities is not as genuine as it would need to be. So providing this sort of framework, this was important for me when approaching sort of this, how the city has articulated what our priorities and what our values are. And so what I wanted to make sure is that currently within our structures, within our place, within our guiding principles, within our articulated values, where is equity? Where is collaboration? Where is diversity? Where is inclusion? Because if we're expected to operate out of the lens that we will be the leaders among this work, is it currently reflected in our statements that recognize what our priorities are? Is it a goal or is it a priority? There is a distinction because there are many goals, but there can be priorities amongst your goals. And so recognizing that emphasis on saying, this is our priority, not only a goal, then how are we operationalizing this in everything that we do? In every one of our meetings, in every one of our discussions. One of the things when it comes to effective strategic planning in the different opportunities that I've had work is that I've had conversations with leaders where I've said the vision, the goals, and the values are essential, specifically as our priorities. And that everything we do every day, in every meeting, in every program, in every training, in every strategic plan, everything we do should somehow map back to something that we have identified as our priorities. If it does not, then why are we doing it? And so what this does is it looks at the guiding values and principles that we should be able to map everything we do intentionally back into. Because if it is not embedded into everything, then we will always have the same outcomes that we've had before, because it is expected of some and not for all. And so if it is expected of all, then how is that intentionality embedded into every structure under which we operates under the umbrella of what we do every day? And so I found some things. The guiding principles and values spoke about collaboration and diversity. Rochester 2034 outlined it even more, talked about equity specifically. And so it was important to me that these things not only be there, but how are we looking at specific expectations of them being a part of what we do and who we say we are. So this sort of the mantra, if I could, or if we would, is collaborative leadership, individual ownership. So yes, I am the City of Rochester's Chief Equity Officer. And I have been here less than 60 days. And I have literally hit the ground running due to COVID challenges, et cetera. But with that, there is an intentional mindset that I want to make clear that the equity, diversity, and inclusion agenda will fail if it's the responsibility of a CEO alone. It absolutely will fail. As we talked about it becoming an expectation of all, then how are we looking at making sure that in every department, every strategic plan, every assessment of every employee, every probationary review, every evaluation, all of these things, that diversity finds its home embedded in them. And so this is where I ask everyone and every constituent, every citizen, every department, every business, every healthcare industry, every educational opportunity that we have, K through 12, higher education, and all there in between, is to look at what is our part in driving equity? What is our part in substantiating and validating inclusion? So it is very capable to be diverse, yet still be exclusive. And so how are we looking at this as a spectrum of saying, we must do more and we must become intentional with finding our opportunities to say, what is my place when it comes to leading diversity and equity and inclusion? And so my mantra for that is collaborative leadership, right? So we sit down together and say, what could or what should or what framework will this take? But it's also us being courageous enough to turn around and say, what's my part? What's my role? Because often we'll place it as a duty or an obligation or a responsibility of an isolated entity. And what time has proven over and over again is that will continue to fail us. And so it's operating under this, what is my part? That individual ownership is critical in making these opportunities sustainable. What is clear is that our city, our state, and our nation are at a point that just doing bare minimum is no longer enough. Just providing minimum quotas will no longer suffice. And so if we must be committed to change, it will take all of us, every council member, every political figure, every community organization, collaboratively to say, we will be more. And so in my role as the Chief Equity Officer, I want to talk about what some of the efforts have been in place, and I lead us to the actual REAL initiative, which I think is a great opportunity that highlights the work that has already been laid. So there has been great support and great effort from the Office of Community Wealth Building, the Mayor's Office, and that's Dr. Lomax Campbell, that is Letitia Doucette, even who's been a great ally of support in pushing the REAL initiative work forward, has even been Councilman Willie Lightfoot. They have been exceptionally engaged with this work. But I want to make sure that I honor, as we talked about before, the work, the interests, the values that have already been started, because these are the efforts that were in place before I even came. And so just to revisit that, I went and highlighted sort of what their purpose is. And it's sort of looking at the primary racial inequities and intersections, et cetera. And although a large portion has been on business and the business sector, there is the intentionality of this being a launching pad to dive into other sectors. And we'll get into that a little bit more in a few moments. But I wanted to talk about what the emphasis is. There are 4 key areas: workforce planning, grantsmanship, community empowerment, and media engagement. And this is in collaboration with the national partnership with the National League of Cities work that the mayor has been involved in to a great extent. And so this is work that I look forward to diving into even more. What I have to say is that I'm still learning about the full scope of this initiative, as literally within my first 60 days, I haven't been here 60 days yet, my focus has been redirected on other immediate urgencies of needs, such as the response to COVID and the additional disparities that actually uncovered in a lot of ways for the city of Rochester. So with that, it takes us into the REAL initiative. So aligning with the REAL initiative's focus, I proposed developing a work that was intentionally in responding to the disparities that were made relevant and that were made very visual as a result of data as a part of COVID-19. Working with the REAL team, what I wanted to do is as there was a group that was already focused on looking at inequities and disparities amongst race throughout the Rochester and greater area, I wanted to use people and structures that are already in place, not go and build a totally new team, but actually build upon the work of those that are already here and align their efforts with work that would target outcomes that their work had focused on. So what I did is I convened the members of the REAL Initiative core team and built upon adding additional parties, and we'll talk about that as well. But what the REAL initiative was specifically to do is to respond to the increase or the higher or the disparating number rates when it comes to COVID-19 cases and deaths amongst our hardest hit communities. And with what our data has shown us is that within the greater Rochester area, those, just as mirrored across the nation and across the state, the communities that have been hit hardest are those that are both Black and brown. And so in direct response to recognizing this deficit, these disparities, the limited access, the limited resources, and the debilitating impact that it is having on these groups of citizens, then we wanted to make sure that we correlated our response with the data to do so. So with the rapid response team, we wanted to directly respond to that impact, but specifically develop immediate strategic action-oriented interventions to increase the supports and resources to those communities. Aligning, as I stated, with the National League of Cities Let's Get Real Initiative core team, we wanted to develop 3 sort of committees or subgroups that would lead collaborative efforts on responding in these 3 targeted areas: education and prevention, testing and treatment, support services, and resources. Specifically pipelining these support critical opportunities into areas that are hit hardest. What I want to say that's the focus of this is that we are absolutely aware that there are many other organizations and community partners and hospitals who are working on these aligned sort of interests. And so what I wanted the committee to do, or the rapid response team to do, was to actually use those efforts to combine with what we could do, which means, as an example, we have Common Ground representation who are doing testing within certain areas. We also have Rochester Regional, Dr. Robert Mayo, and with Common Ground, it's Dr. Linda Clark, who have both been part of sort of COVID-19 response efforts within the greater area. But what we did is that we wanted them to both come together and tell and provide guidance for us as a community with what are the areas that there may be gaps. So what we did find in working with the Monroe County, because Monroe County is one of the critical partners working with this, what we did find is that there are specific areas in the Rochester, Monroe County area, specific zip codes that have been hit hardest. And so recognizing that, we partnered with Monroe County personnel to confirm that the data that we possess correlated with leading our priorities. So among the data provided us that the 14609 and the 14621 area codes within the Rochester area are zip codes that have been hit hardest, so that when people are sick, those community members are sicker. And so when it comes to making sure that we are being data informed in what communities we are looking at, it's making sure that we are partnering with the content experts in the medical area who are providing us the data to actually guide our decisions. So recognizing that these two zip codes are two of the communities, or two of the zip code areas that have hit hardest, and we have chosen to focus our immediate efforts on concentrating to these most vulnerable populations. With these three areas, we are providing, as we stated, the education and prevention, the testing and treatment, as well as support services. This graph here structure only highlights the overarching focus of the rapid response team, so that it is clear that it aligns with the core primary subject matter of the real team, but builds upon specifically partnering with community and specific county organizations and entities that have the resources to help target these specific areas needed most. What I will say is that I think it's a great opportunity for us to build partnerships with the communities even more. So as an example, what we have found is that of the 14609 and 14621 area codes, as well as so throughout the county, there are many areas offering testing. As an example, many areas that are offering testing throughout the county, but each of these areas that are providing testing and treatment options have different criteria in order to even get accessibility to them. Some of them require that you have to have confirmation from a physician that has given you the clearance to get a test. Some of them actually require additional insurance that others may or may not have. Some of them require that you get preconditioned full respiratory infection sort of assessments done before. So what our initial effort is to do, one of the things that the treatment and testing area is doing is actually mapping out physically a pin map that you will be able to click on a specific pin of where there is a testing center to find out what their hours are, to find out what their location, their physical address is, to find out if there are any specific requirements that you should know prior to arriving. And so this is one of the ways that we're looking to help sort of close the gap that supports the efforts of the centers, but actually provide the resources in a greater way that could assist. So in the 146 and 14 and the 09 area code, the 09 and 21 area code, there are some testing centers, but I think it's the 09, there are almost minimal to none. And so as an opportunity for this group, we are currently considering and looking at ways to have the pop-up opportunities, the mobile testing centers placed in these areas that are hit hardest. One of the challenges is accessibility. So if there are no areas within these specific zip codes to even get a test, then that's a huge a gap in resources, so that can impact whether we are providing resources or creating educational opportunities, prevention opportunities, so that the knowledge of if you are even asymptomatic or not would be critical in helping us to prevent the spread. So all of these initiatives and efforts are what we're looking at that, again, will help build on what's there, but actually assist in closing any gaps when it comes to access that may not be there. And so what I wanted to do is also provide, if I could, a team representation chart that identifies what groups of people, as you see, and we intentionally reached organizations to be reflected on this committee that were both of the county as well as the city, but as well as honored the great work that is already being done in respect to some of the opportunities responding to COVID as well. So I wanted to, because I was asked to speak about the work on specifically with COVID, I wanted to talk about, well, the rapid response team, excuse me, so that I could make sure that I was providing a context, what the focus was, how it aligns with what our current structures in place. So correlating it back to the real initiative that is the ongoing long-term opportunity to look at some of these issues. What's also important that the core team members be a part of this work as well is because this will allow the core team members affiliated with the rapid response team to take these knowledge-based, data-driven outcomes back to the larger real initiative work so that we are not excising the two separately, but that we're allowing one to build on the future work of the other. So the work becomes sustainable and also intentional, as we discussed in the beginning. So this is just to talk about a little of the work that the rapid response team is doing in response to COVID, as well as we've been out in the community. I am so grateful for a lot of the team members. As we talked about, the focus of this is to look at limiting or decreasing the spread and the mortality rates amongst these communities. So when the protest started and the demonstration started, we were very concerned. And because what we stated is that we did not want for people to go out there and not have the resources to protect themselves. So we understand that there is a valid reason to demonstrate and a valid reason to protest. And so as a committee and as a city, the committee decided that the rapid response team decided we wanted to be there to make sure that if people were going to be demonstrating, that they had the resources to protect themselves, that they had the resources to prevent it from spreading even further, as this was a core functionality of what this rapid response team was about. So in all of the protests, all of the marches, all of the demonstrations, there were rapid response team personnel. So the very same people who sat up and wrote all these strategic plans actually rolled up our sleeves, put on masks, put on gloves ourselves, and actually were in the crowds at safe distances, making sure that the people that were there were doing it safely. And that's just a part of the work that this team is about. And we look forward to building on that going forward as we look at sustainable ways to continue the work by embedding it into the larger real initiative going forward. So other than that, I think that was my last slide to talk about the rapid response team. And I am available to answer any questions about any of the work that we have spoken about today.
Dr. Archie, this is Councilman Lightfoot. Would you be able to provide us with like a 30, 60, 90, either or plan going forward that you would have? Would you be able to provide us with something like that at a future date?
Is this for the plan for the rapid response team, or would you mean the plan for the real initiative or my work as CEO?
Oh, yeah, as CEO, definitely. Overall arching plan, as CEO.
So I will be glad to do so. I will say that's going to be a moving target for a little while, because literally, had we not been in the middle of two intersectional pandemics, I would immediately come in and say my first 90 days would be to learn the lay of the land, right?
Okay.
To get engaged with the community members, to find out what is going on, to find out what is working, to make sure that I'm listening and make sure that I'm getting the perspective of the varied stakeholders that actually impact the quality of what this works look like. And so that's very, very much needed. And unfortunately, due to the pressing immediate urgency of the challenges that we've had both locally and nationally due to COVID and et cetera, it has steered me away from doing what I would do normally, which is to first off walk in and do a listening tour and do an assessment of what we're doing now. But hopefully I will have more time to do so. As recently has been announced, there is work now that's being started on the commission for racial and structural equity as well. So I am now turning my attention toward that direction. So that will be sort of a priority for me going for at least the next 6 months. But in addition to the commission, there are other duties and responsibilities that I will be leading as well. So yes, I can give it to you, and I'll be more than glad to do that. But I have to say it'll be a moving target based off of the recent priorities that have come about that were not initially expected. So yes.
Very well. Thank you.
Dr. Archie,
Dr. Archie, oh, go ahead, Council President.
This is Loreta Scott. We haven't had the opportunity to meet, and I apologize for my tardiness at the beginning of this segment.
Pleasure
But because I wasn't there at the beginning, I didn't know how to listen. What was I listening for in your presentation?
So there were two things. I was asked specifically to speak about the rapid response team and why was it created, what need was it filling, any progress, what's the next step plans, focus, etc. But I also wanted to provide the initial part of the presentation offered me the opportunity to talk about how what framework do I look at equity and what framework, looking at both short-term, long-term, starting at the core and my understanding of the work that I am charged to lead. And so looking at that at the beginning of the presentation, I talked about the framework, which means when I walk into an environment, one of the things that I immediately begin to do is to inventory and assess what is going on now so that I cannot either duplicate efforts that are already being done or so that I could not make decisions on things that have already been tried and proven and not effective. And so that first level of engagement with me is sort of being a researcher, right? So becoming a doctor, there's the whole lit review where you have to go back and look at what's been done regarding your topic before you started thinking about your topic so that your topic builds upon the work that's already being done without you having to go retroactively and try to find things that may have or may not have worked. And so that very same strategy is how I look at developing systemic change. And so I outlined sort of that process of inventory and assessment. I also talked about rebuilding, but rebuilding collaboratively and making sure that we had certain people at the table to make sure that their voices are being heard in our decision-making processes. But then at the core of all of that, it's clear to me and the research that I have led and making sure that every decision that we make is done intentionally to make sure that equity, diversity, and inclusion are sort of not an add-on, but they're sort of the core functionality of every governing decision we make, every policy, every law, every procedure, every practice. And so that's what the context was.
Is the real, I saw the part about the real initiative, but it looked like it was, the activity was sort of focused on rapid response and all of that. So
Sure.
of the work that is done already in real, how does that factor into your job?
So with the Real Initiative has a component of business. And so with the business component, so the Office of Community Wealth Building, Dr. Lomax has really been intentional with developing steps, benchmarks, progressive measures to outline supports and connections with making equity a more prominent focus within the business sector. And so as the business sector is critical and is inextricably linked to so many of our other sectors, right? Education and healthcare, et cetera. That is a large focus and core component of what we're looking at with changing the drive on what equity looks like outside of one specific sector. What I do appreciate about the Real Initiative is the work with the equity toolkit that was developed per the first academic year, because it was, well, the first year, because it was chartered January 2019. And as a result of that, Dr. Lomax, Letitia, Woody Lightfoot worked with the mayor to develop the budget equity toolkit, which I think is a great structure for change. So if we can develop a toolkit that's specifically itemizing in our budgets what we will be using to confirm that equity is driven into every budgetary consideration, and we could also mirror that structure to make sure that in every one of our policy considerations, is there an equitable toolkit that says for every one of our policymakers, before a policy is passed, is there sort of a toolkit in place that confirms we have considered these specific things along the way before that policy is driven? That very same metric can be looked at in our procedures. The very same metric can be looked at in other areas. But what I appreciate about the Real Initiative is that it started the work in a way that was in the budget, but that actually can be replicated to other sectors to help build more equitable structures that can be systemically driven.
Thank you.
Sure.
My question was, hey, Dr. Archie, how are you?
I'm okay. How about yourself?
Good. My question was, you know, chief equity officers, you guys have extremely tough jobs. In a disparate organization like the city, where you got city departments, then you got fire, you got police, you have all that. Obviously, the mayor, council, we're committed to this stuff. What are your thoughts and strategies in terms of pushing down this equity conversation to middle management and like frontline folks? Because that's often where I see it gets hard in conversations like this in various organizations. The top will say, yeah, we get it, but it's hard to get the folks in the middle to kind of embrace it and push it and talk about it.
So I think our roles as leaders plays a heavy part in that, Malik. I really do, because as the leaders, we set the expectations, right? We set the expectations. We ask that people model our behavior. And so I think that it's essential and critical that we begin to adopt, and not only adopt, but to operationalize these expectations of persons. So one of the things that when I talk about systemic change, let me give you an example of that. So if we incorporate it into, and I'm not saying that this will, or I'm making it, my stance, a hard line, but what if we entertain the idea of confirming that every year as a part of our annual evaluation, our assessment processes of all of our employees, we embedded one question or a couple of questions that highlighted or that ask, please list the number of equity, diversity, and inclusion opportunities you participated over the last year. If that smaller statement is embedded into the evaluation of every employee, what it will immediately do, because we don't want to do the whole, our approach is to say, oh, I got you because you didn't do it, but make sure that it's communicated in advance that we are expecting every one of us to be doing these things. And if they realize that they're going to be evaluated and assessed on it at the end of the year, it allows them the opportunity to meet the expectations that you've established. But if it's absent from what our expectations are, although it's highlighted in our values, although it's highlighted in our guiding principles, although it's highlighted in our priorities, if it's not reflected amongst the things that we are assessing annually, then we are missing the opportunity to connect our values to the actions that we're asking of each of our employees. And so this is when it becomes systemic. So that often what times happens, Malik, is that when you hold a training or a program or an opportunity for equity or diversity or inclusion related structures, most of the time the people that show up are the people who already get it, right? They're the people who
right.
And that's because it's not expected of all, it's optional. But if it becomes an expectation of all, then you change it at a system level versus at a personal interest or value level. And so if we say that it's a value of the city or the organizational structure as a whole, and how are we aligning that with the evaluations that actually align the two between what we say is our priority versus what we look for to be confirmed in our actions? And that's just an opportunity where you can make it systemic versus isolated, independent, interest-based only.
Yeah, absolutely.
Okay.
Yeah. Thank you.
No problem.
So I have a question, and you said a lot. Thank you. But I guess maybe I'm oversimplifying some things. So is the expectation for us in the next, as I want to give you time, but 6 months, year, I'm not sure, that we will receive some sort of roadmap or document that you're going to be able to provide for us that says, from a policies perspective, this is what we're doing, this is where we want to go. From a tangible actual metrics perspective, this many individuals, because we were underrepresented in these areas, then we want to get to X number of individuals in these areas or professional levels. I'm trying to understand what is it that we hope and like tangible output.
Sure. So well, first off, thank you, Jackie. That's a great question. So just so that you all know, I am a data-informed decision maker, which means what does my data tell me as a starting point? So one of the things that I appreciate about the work that Dr. Nichols has led, and she's on the call this evening, is that we do have an affirmative action-based plan, which is inventory of throughout every department, every office, every position within the city that breaks it down by race, by gender, by specific demographics, so that we have a running chartered document or a database, if you would, that has inventoried where we stand. With that document, in review of that document, an affirmative action plan tells us what. It doesn't provide necessarily a solution of how we're going to address it. And so one of the things that I want to do is to become more involved with using that data that's as a part of our affirmative action plan to drive the what are we doing about it, which is where I want to use the real initiative to actually say we're going to marry that with the affirmative action plan, which tells us where our deficits are. And the focus of the priorities established in the real initiative will say, this is our map and this is our plan for what we're doing to address the gaps that are defined in our affirmative action plan, so that these individual plans will begin to be linked inextricably together, so that one is an awareness and the other one is the response. And so having these systems in place be the metrics that we use to say, every year I want to benchmark it. So this is where we were year one. This is where we were year two. This is where we were year three. And having a plan in place that we can tweak, that we can assess to say, wait, after 3 years, there is no progress. So there is no intentional emphasis of continuing to do the same thing if we're getting the same results. And so it's having the annual benchmarkable progress to be able to guide what we do and how we do it, and having that real initiative really be a core driver of the opportunities that we are considering to address the deficits of our plan. And so that will be a large functionality of saying, this is where we will be outlining those next 6 to 9 months, which is reviewing that data, which is reviewing how we are doing, which is when it comes to hiring and recruitment of diverse groups of people. What I don't want to do is to let that be the only metric. So one of the things that I'm also looking at is I am the city's affirmative action officer in its context, which means the investigation regarding discrimination, different types of harassment, sexual assaults, etc. Every year, I'm going to be correlating that data so that I am benchmarking. This year, there were X amount of concerns that were addressed about this, X amount of concerns addressed about that, X amount of concerns addressed about this. So we're using the data to guide our training efforts. So one of the things that I'm going to be supervising going forward is the city's training personnel. And the reason why this is important is because as I'm privy to all of the data relevant to concerns, discrimination, etc., how are we using that data to drive what our constituents need to be trained on? So that, again, we're responding and having systems in place that tell us how we are intentionally investing in responding to the needs that are being brought forward. And so this is where that data will be used to drive our responses and what our trainings need to be. And so over the next 6 to 9 months, it will be a lot of correlating that data, seeing not only in one department what the complaints and concerns are, but across the board, so that our responses support the work that we've seen has been identified, that our data has articulated. And so this is where I would say over the next 6 to 9 months, my focus will be, which is looking at now even how are we collecting that data? I wanted to make sure that when I got here, are we even collecting it and assessing that on an annual basis to know what our climate culture concerns are, so that we are benchmarking it every year. So if year one, we had 20 of these complaints, but in year two, we went down to 5. So are we looking at what happened, or is the data, is the training being infused in a way to prevent those things? So this is what I'd like to be able to provide over the next 9 months, I guess, because with the commission, that's going to take some time. But I still want to make this a priority going forward to benchmark how we are either progressing or regressing every year.
I wanted to ask a question. Jackie, were you done?
Yes, I'm good. Thank you.
I wanted to ask, so I think that one of the most challenging parts of the work that you're set out to do, and that I've learned from Vice President Lightfoot associated with the REAL initiative, is that the policies of the city of Rochester are not just the policies of the city of Rochester. We are in an ecosystem where the county controls certain things, the state controls certain things, and we're seeing this in a really kind of brutally honest way right now when it comes to all the things related to police reform and the different spaces where city, county, state, and feds all have to kind of overlay on top of each other. So I guess I'm just wondering, from your perspective, how do you intend to, let's forget the state and feds, because that's a little bit harder to answer, but how do you intend to work closely with the county to figure out how to be the best chief equity officer that we can have in the city, recognizing that so much is contingent upon what the county does?
So that's a really good question, Mitch. That's something that has been grappled with by cities across the country. And I want you to know that I value the question. I think it's a very merit-driven question. What I will say is the opportunity for the developing commission that we are working on now is an opportunity to address those things. So as one of the functions of the commission, as they are currently being rolled out, teased out, deciding parameters, the scope, all of these things, is not only to look at the local laws that each entity has respectively. So there are county laws and policies, there are city laws and laws and policies, right? But not only to look at those individual laws, but also to confirm that if there are any laws that actually conflict with the values of equity, diversity, and inclusion. So what if there is a county law that actually is in direct opposition to a city law, and how is enforcing one going to cause conflict with the other? So as a component of at least being able to control the local laws and what we're doing about them, this commission will have an opportunity to at least review them to say, what are the laws that we do have in place? Just like we talked about the research and the inventory and an assessment, what are the laws that we have in place now that are not working, that are either conflicting with city and county? What are the laws that we don't have at all? So what are the laws that in order for the current laws to work, we must bring in something in the middle to make sure that they are joining the two. So this is where this opportunity of the commission will be able to provide context on those higher level laws and those higher level policies, not necessarily the specific departmental or organizational policies specifically, but what are the governing laws that are owned locally by each respective governmental entity that actually filters down into the operationalizing of what that looks like at the immediate organizational level of that. And so this is where a focus or the charge of this commission is focused to do some of that work. It's not going to be easy, and we're aware of that. And it's not going to be a one-hitter quitter. It's going to be us becoming very intentional and saying, go back, even when we have to dig deeper, because something may not be as apparent as it could or should be. So
I agree, and frankly, I'm very grateful that I'll be serving on that commission alongside you with Vice President Lightfoot. I'm looking forward to the work that's going to be done. I guess, and I think it's very appropriate that the county is involved in this. I guess my question from a more kind of specific lens. I'm not sure how long you've been in the greater Rochester area for, but this is a pretty unique moment in the sense that we've only had a Democratic county executive once in my lifetime. I'm 34 years old. It was a 4-year stint. And we got another one now, of course, immediately was kind of swept up by COVID within 2 months. Sure. So we have an opportunity now. It's a unique opportunity. And I guess I just want to understand from your perspective, do you have a peer at the county? Do you feel like this commission is going to forge that relationship, or do you feel like you've already started to kind of hit the ground running with the county as a partner?
What I can say is I can say yes to both. So before I came aboard in this capacity, just in all transparency, I was not as aware that there was such a strong line historically, right? I wasn't aware of that. Learning that quickly, it became very intentional with my engagement of partnering with the city, not just on the commission, before the commission, the rapid response team. So what's helped sort of the development of the steps for the commission is my pre-entry with engaging their executive leaders and their commissioners by inviting them to be a part of the rapid response team. What I did know is that the county owns a lot of our Department of Human Services supports around the city, right? They have the governance, the legislature for that. So if I'm going to develop a team that's supposed to target the people who need it most, the services that are owned and the processes are owned by the county. And so it was essential that I build that partnership immediately, not for own internal politics, but for the people that it was intended to benefit. And so recognizing that impact is where I think that partnership has really started forging itself even more so that it wasn't a first-time commission approach. It was, no, Dr. Archie's out there with us at protests passing out PPE to people. And they were there with us, which was important. So they didn't just come and sit on the Zoom meetings. They left their offices. They left their families on Saturdays and put on gloves and masks and came with us in the heart of Rochester to make sure that we were doing these efforts. And so that was very encouraging for me as someone coming in from the outside, is because I needed to see that we were more than just our meetings, and that we meant what we said by getting our hands and feet to the ground and being amongst the people to do the work. And so I'm very encouraged at that partnership, because they have demonstrated that intentionality with wanting to build that partnership as much as we do.
Yeah, that's great. I guess I'll close by just saying this. I think it's important that people came out and put on gloves and handed out masks with you. I think it's important that you're developing the relationship with them. I think right now one of the things that I find most frustrating, I'm not sure if you're aware, but we had a budget hearing a couple weeks ago, and we all received our budget to vote on. We all received north of 1,000 emails using language like, we demand that city council do X, Y, and Z, with truly close to half of those emails coming from people from the suburbs that have zoned poor people out of their communities, suburbs that have segregated their school districts. And so the masks and gloves are important. I think what's more important is letting not just the county, but also the towns understand that we can hire a chief equity officer. We can be as mindful and as smart about this as we want to be. But if we're one out of 19 municipalities in Monroe County, and the rest of them don't understand the roles that they play in building a more equitable community, we're in trouble. And we as council members, I don't think, have nearly the same vantage point that you do as the new chief equity officer of the city of Rochester to help drive home those points.
Valid point. I can't even challenge it. What I will say is that I think now is an opportunity now that I don't think we've ever had. I think there is a heightened awareness as of this moment that I don't even think they had back in the 60s that is demanding for that change. And so, as I stated in the beginning, it will not work if it is expected for some of us to be a part of what this could look like. And the rest of us are feeling as though it is those and their duties versus ours. I have to say, a lot of my work is the ability to believe that we can be more. And it's that hope at times that I hold on to that says, even when I don't see it, as a leader, I must aspire to say we can be. And so using the power of this moment and the momentums that we have, I think if we truly capitalize on it, there can be change. But I agree with your concern.
Amen. Let's do it.
Unfortunately, we are right out of time.
I have a question. Can I get it in real quick?
Quickly, please.
Yes. Dr. Archie, to referencing those 1,000 emails, we were getting very specific asks about cutting the police budget and looking at alternatives to policing. And, I really thought that this task force would be able to take a look at that. But when I look at the mission, it's very, very broad, and it's countywide instead of city. And so, can we tell people that this is going to be looking at the RPD is going to be a subcommittee of this task force? Is it going to be a main focal point?
So what I can tell you is that law enforcement are a focal point of what is going to be considered for reform as a part of this commission. Yes, that is a part. It's not the entirety. And that's because what we do know is that we all have a duty in keeping us safe, right?
Let me speak more directly to that as well. Dr. Archie will not be laying out the framework of the commission. That's going to be done at another level. I'm sure he'll carry it out once it's laid out, but he won't be doing that. So in terms of the additional information we get about what's going to be included, we'll have to get that from the mayor and others. Okay.
All right. And I'm sorry, I have one more thing as well. I know I'm at the end here. It's going to be quick. I just wanted to send forth the information that I've gotten myself concerning people who work at the city, as well as just my own views at the city. And that's a false argument in itself. So I really look forward to working with you, Dr. Archie, making sure that the city is not hiring specific races for, commissioner and supervisors, and then a different race for answering phones and cleaning City Hall. So I would love to take a look at that as well, the racial breakdown of who's being hired for what positions, because just because we're saying we're hiring Latinos doesn't mean we're hiring Latinos for, higher up.
Sure, I agree. That's the distinction for being diverse and then being equitable, right? You can be diverse but have isolated silos for certain levels. Yeah, I get it. I understand. your concern.
Councilmember Pio, one of the responses that we got from the budget process outlines a lot of what Dr. Nichols' work was in that regard, that breaks down positions by gender, race, and sort of level, or there's a certain number of categories of position. And that's been provided to you.
Thank you. I just be remiss if I didn't say anything.
Point noted.
Okay, I thank you, Dr. Archie. It was good meeting you via
Thank you. The
Zoom.
pleasure is mine. Thank you all for your work. I appreciate it.
All right, we're all done. And I don't think we have a meeting tomorrow. I'll miss you, but I'll manage.